As the world continues to recover from the pandemic, doctors are sounding the alarm on a hidden impact of COVID-19, especially in women. A new study published in the European Heart Journal reveals that the virus may leave lasting damage on women's heart health even months after recovery. Let's tell you more. These videos raise several questions on what was killing these women and girls. Why were women and men alike suddenly becoming prone to heart disease? A new research is pointing towards a COVID link, and it answers those questions now. It reveals the virus may leave behind a hidden legacy, prematurely aging our blood vessels.
A lot of these patients are having aging in their arteries. Now, aging in their artery means people who are 50 or who are probably 60 are having an arteries which are much worse than what their age would be. And I think COVID is probably somehow responsible for this.
Well, the COVID link to heart attacks in women is something that has now been established. The research was published in the journal European Heart Health. The study was done across 16 countries involving 2,300 people, half of which were women. The vascular age, the vascular health was something that was measured. The age, the actual age of an individual as compared to the age of the blood vessels, that was done through a study called the pulse wave velocity. In fact, the faster the velocity, the stiffer the arteries. So is that the reason why many more women are now reporting heart ailments and are dying of heart attacks?
The amount of heart disease incidence which has gone up, I would relate it to COVID-19 per se. It has gone up both in men and women. However, women didn't come at the young age with heart disease. Now they are presenting at the very young age, 25, 27, 30, with heart diseases.
The study did find that women were more affected than men, particularly those with long COVID symptoms like fatigue and breathlessness. Even mild cases showed vascular damage equivalent to around 5 extra years of aging.
Unfortunately, it has affected women more than men. We don't know why, but it's probably because they had stronger immunity. So they had a stronger immune response to COVID. And this is what sort of made them worse, are more affected by these blood vessels, which got stiffer, which are aging faster. And it increases the chance of them getting gangrene or heart attacks or even strokes.
What about the impact of the vaccines? Did they not protect against severe infection?
Vaccines have been known to cause some kind of cardiac issues in some of the vaccines, not all the patients. But we're still not sure what the vaccine had implication in it. But we definitely know patients who had COVID infections had much worse outcomes.
Well, if you've had COVID, especially if you're still experiencing symptoms, talk to your doctor about heart health and make sure to stay on top of blood pressure, cholesterol, and lifestyle habits that protect your blood vessels.
3 things which you cannot change, like aging, like previous history or a family history. But if you can control your diabetes, if you can control your blood pressure, if you can stop smoking or smoking cessation, as well as a regular exercise, fruit salads and antioxidants in your diet, all these things, and even yoga meditation, all these things helps you in maintaining a good vascular health.
In New Delhi, Sneha Mordani for India Today TV.